UnitedHealth Group insurance company is under fire again, this time for alleged illegal nursing home practices. Democratic Senators Elizabeth Warren and Ron Wyden have accused UnitedHealth Group of giving nursing homes bonuses if they reduced the number of patients sent to hospitals. An August letter from the Democratic lawmakers demanded the insurance company hand over records by September. It is now almost November and still no files. NewsNation did reach out to UnitedHealth Group for a comment on the story. This is their response, in part saying they did receive the senator's letter and will continue to educate their staff and share information on the ISNP model. Now, UnitedHealth says it stands firmly behind the integrity of its program and says the Department of Justice found no evidence of any wrongdoing of the allegations. But families, they want answers and they want reliable care. Joining me now is Vincent Cinque, who has a mother and grandmother in a nursing home. Vincent, good morning. Thank you so much for coming on and sharing your story.
Good morning, Hannah. Thank you a lot for having me.
You say your mom was advised to switch to UnitedHealth's Optum program. It's one of the policies that's under scrutiny. What was her experience when she switched policies?
We were told that we would be able to receive more individualized care for a situation that needed more individualized attention. But after we switched to UnitedHealthcare's plan, my mom was moved to a locked dementia unit. My mom does not have dementia, and I'm currently working with the Disability Rights New York organization to help try and get her off of that floor where I believe she does not belong.
She's in a dementia unit, and she has not been diagnosed with dementia.
Correct. My mom has traumatic brain injury, but not dementia. They're very different.
What has the response been like from UnitedHealth or the nursing home? You heard the comment they gave us. What are they telling you?
I have heard nothing from UnitedHealthcare. We're working on getting any claim documents because we don't know whether these decisions were made by the nursing home themselves or at the directives of insurance. I am just a son, a grandson who loves their family and just wants to get them the care that they need. My mom needs some very urgent orthopedic care that's been halted for almost 4 years that I've been trying to get her. And I'm just a son. I don't work for healthcare. I don't work for insurance. And I just want to get them the care that they need, and it shouldn't be halted this long.
I am curious. You know, I was reading about this, and United says they're just trying to avoid sending the elderly back to the hospital because sometimes it can be fatal for seniors. What do you think about that argument?
As from my experience, my grandma, who is about 87 years old, from my understanding, it's potentially that the nursing home concealed a potentially harmful diagnosis and medical issue from me for upwards of 8 months. And I can't really think of any other reason that me as her healthcare proxy and her power of attorney wouldn't have been alerted of the situation other than wanting to keep hospital transfers to a minimum. Whatever it was, I don't think my grandma's best interest was in mind when these decisions were made.
Well, also the lack of transparency. Senator Warren and Wyden asked for records in October, for the summer, and they still haven't gotten it, and it's near November. Now that the Senate Finance Committee is launching an investigation, has anything changed for you here?
I have to say that we just switched over to Optum this year in the springtime, and we've been dealing with nursing homes for about the past 4 years now, and I'll say that though there are people who care very much within these systems, as a whole, the system does not seem to center patient needs. It seems to center profits. And I just really would like to see things change for the better and for people who are vulnerable and elderly. And these people in these nursing homes, they're not just old people who can't speak. You know, there are young people. My mom is 64 years old. I've made incredible relationships with some of the people there, and my heart breaks for the people who don't have anybody advocating for them, even though I do understand how hard, because it feels like the system is designed to break us, to crack us, and to make us give up. But I don't want to give up on my mom, and I don't think any of us should give up on not just the elderly, but the vulnerable people in our country as well.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.